Hello guys, and welcome back again to my channel. My name is Chris TV, and if you haven't subscribed yet in my channel, kindly please do so, because I'm sharing a lot of things from my personal blogs to the experiences that I have in a cruise ship as a nurse. At the same time, a lot of things about nursing. So in this video, especially right now, I'll be sharing with you guys some tips and tricks, not tricks, but technically some ways on how we're going to manage our Nclex board examination more easily and more confidently. And for you out there who has no idea what is Nclex is, this is the national licensure examination that a foreign nurse needs to pass in order to practice or work as a nurse in the United States of America, in Canada. And also, this is widely recognized right now in the states of Abu Dhabi, Dubai, and in the Middle East like Saudi Arabia. So having this kind of licensure examination can make you work in a lot of countries. So this is the very best time. Second thing is that right now the visa bulletin for the Philippines is just recently been out in the public right now. It's in current, so meaning to say a lot of immigrants can process their applications, as one of them would be nurses actually, which is very much in need in the United States of America. So this is, I think this is the very best time to do it. And yes, all right, okay, so just a little brief introduction of who am I. So I've been in the nursing industry since 2008, so I can say that I do have lots of experience, which I work hospital based, occupational based, oil rigs, and lately, I mean, the latest one that I have is I've been working as a cruise ship nurse. And another thing, just a brief disclaimer, guys. I'm not part of any review center. I'm not a reviewer. I'm just an ordinary guy, nursing guy, nursing student guy, nursing professional like you, who just passed the boards like 2 years ago, and I just wanted to share the knowledge that I used during my examinations that actually helps me a lot passing the board exam. So without further ado, let's go in the subject matter. Here you go. Alright, so hello and welcome back again. And yes, like what I promised, I'll try to help you guys with your NCLEX examination, your board examination, as much as I can, with the things that I use during my boards, my pre-study before boards. So I'll be sharing with you guys this one, and I really hope that this one would help you and to pass the board. So basically, for this video, we'll be more focusing about the acid-base principles and all about ventilators, the way that the boards want us to know. So we're just dealing with those things first, because why is it important to know and understand the basic principles of these acid-base imbalances and ventilators? The thing is, knowing such things will give you an edge as a nurse in determining what is the status of your patients and what will be the possible management that you can give to your patient. That's how important it is to understand the basic principles of acid-base imbalances. Okay, the boards will not go deeper of understanding and giving you some difficult questions, but rather the boards will only give you some certain scenarios that if you understand the basic principle about it, then you can actually answer it confidently and easier. So in this video, we'll be sharing some information. I'll be sharing with you some information that I used during my study for the NCLEX examination, for the board examination past 2 years ago. And I find it still very effective nowadays. Even though, because the thing is, doesn't change that much in terms of acid-base principles. So the concept of these rules that we're going to share with you applies the same until now. All right, and yeah, like from my intro, it's very nice to have your boards passed right now, since a lot of nurses are required in the US, and at the same time the visa bulletin is encouraged, so technically it's more easier to process your US application. So okay, so going back to the topic, so we should say that our first rule for the acid-base principles is what we call the rules of Bees. Okay, what does it mean, the rules of Bees? Wait one moment. Let me just lower this one. Okay, so what does it mean? The rules of Bees meaning is just simply as what they called it. It's like bicarb, both metabolic. So that's the rule of Bees. So B, B, B. So it's bicarb, both bolic. Okay. It doesn't mention any R, which means respiratory. So it's only bolic. So bicarb, both bolic. So what does it mean? In the arterial blood gases, there are a lot of data that they will provide you: the PCO2, the pH, the bicarb itself, and a lot of stuff. Okay, but in these rules, we're just going to be more specific in two major and important part of the ABGs, which are the bicarbs and the pH. Those are the only things that we're going to look into this. For what reason? Basing on the rules that we have, the rules of Bees, bicarb, both bolic, it does mean only that if both bicarbs and pH goes in the same direction, whether it goes up or it goes down, we will use the prefix metabolic. Okay, so it's gonna be metabolic. Okay, that's the rules of Bees. Okay, so so what if they are different? Then we don't have any choice but otherwise use the prefix respiratory. So that's how it is. So that's one rule, how we can separate confidently the metabolic from the respiratory imbalances. Okay, so but in order for us to know how it works, we need to find out first, or we need to understand first, the normal value of the pH and the bicarb. Okay, so we go first with the pH. Okay, so pH, all right, so we can see a lot of these things in a lot of products that actually says the normal pH. So it's like a universal knowledge for all the nurses in the entire world, or community of nurses. So it's basically pH is 7.35 and to 7.45. How can we easily understand and remember that? It says that if you have pH, you have more normal and much more, we can say, like good bacteria, right? Or I mean, good looks, the area is really nice. So between 7:35 up to 7:45, where the sun rises, right? So basically, it gives you a much more better, we can say, like better vitamins, better nutrients. So we can just, you know what I mean, right? So it's basically just like that, the concept of how we can easily remember the pH normal value. So it's 7.35 up to 7.45. Okay. The second important is what we call the bicarb. Okay, for the bicarb, so this is what we call the bicarb years, where when we say bicarb years is that this is the years where actually teenagers become more independent. This is where they usually do a lot of their decision making on their own. So we can consider this age is between 22 up to 26. 22 to 6. Okay, 22 up to 26. Another way how to remember is just remember the 6. So if you divided 6 into 3 parts, like for example 2 plus 2 plus 2 equals 6. So it's 2, 2, 2, 6. So that's how it works. So 22 up to 26. Okay, and then okay, so since we know the normal value of the pH in the bicarb, now we can proceed on our examples. Okay, so basically in this example, so what is this example? Okay, determining the pH, it goes up, right? Goes up. So we can put the arrow up, going up. And the bicarbs, good. That is going up as well. So from the rules that we have, bicarb both bolic, so we can say that this is metabolic. So we'll be using metabolic. So just write it down, metabolic, as a first word. There you go. You got it? Okay, perfect. Now, in order to determine the second word, we need to check the pH. Okay, since the pH goes up, it's more than 7.45. So we can say that this is it's alkalotic. So we can say this is alkalotic. So you can write it down, alkalotic. So we already identify this pH imbalance as metabolic alkalotic. Okay? Good. Okay, so let's go to the next example. So this is the pH. Okay, good. So the pH is below 7.35. So we can assume that it's going down. The trend is going down. So we can put down arrow. Then let's check our bicarb. Perfect. So it's also going down. It's less than the normal value, which is 22 to 26. So it goes down. So we can say that both pH and bicarb goes in the same direction. So we will be using metabolic for this one. Perfect. Okay, so let's go for the second word. In order to finalize which kind of imbalance is this, let's have a look on the pH. Good. So since it goes down, so we can safely, confidently assume that this imbalance is acidotic in nature. So we can coin the word metabolic acidosis. Okay, so that's how the rules applies for this one. Okay, so good. So I'll be listing a little bit more of the samples here, and then we can try to determine what is this. Okay, good. So on our first question, the pH goes down. Perfect. Bicarb goes down. Perfect. So we can say this imbalance is metabolic acidosis. All right, good. I hope you got that one, our first one. And the second one would be pH goes up. Bicarb goes up. Good. So we can say that this is metabolic alkalosis. Perfect. Okay. How about this one? pH goes down. Bicarb is in normal. Okay, let's go back to the rules. The rule says if both are in the same directions, we can safely says that this is metabolic in nature. Otherwise, we will use the other one, which what we call respiratory. Okay? So since the pH goes down and the bicarb is in normal, we can say that this is an example of respiratory, and then the pH going down, so it is acidotic. So we can safely say this is respiratory acidosis. Good job. Okay. So as a summary, so both bicarbs, both bolic, if the same direction, we will safely say that this is confidently say that this is metabolic in origin. If not, even though it's in the other one is in normal range, either it's pH or either the bicarb, we can say this is respiratory. Okay. Okay, and in the boards, it is very seldom or very rare that they will put a lot of mixed log values, but rather what they're going to do with this one is that they will keep it like as it is. That's where one particular part will be a little bit higher from the normal or lower than the normal. So it's something like that. Now, another one. In the boards, sometimes they'll put a statement which actually tells you that the patient is having this kind of imbalances, either metabolic acidosis or respiratory alkalosis or other stuff. This will be like a SATA question, so it's like a select all that applies. So you'll be given 6 options out from the questions. So you will need to determine whether what is the symptoms that you can find out from the given questions, whether if this is having this kind of imbalances. So with this one, the boards doesn't want, or I mean the boards will not test your knowledge in terms of the list of different kinds of possible signs and symptoms, but rather they will test your principles of how depth your knowledge about it. Okay, by what means? Of course, they're going to generate the list. So it's almost, well, it's funny it looks at this, but the thing is, they're not going to look into the list, but rather they will be looking on the principle on how you actually know the possible signs and symptoms that you will encounter to the given imbalance, acid-base imbalances. So that's how it works. So we'll make it a little bit more simpler, much more easier on how we're going to understand it. Like for an example, we can say that some scenario they'll be given like opioids medications, which actually are pain meds. So in general, the idea of having the pain meds or the opioid is actually sedating you. So it is a CNS depressant or the central nervous system depressant. So what would be the possible symptoms that you can find in a CNS depressant? Option number 1 is that less reflex or more reflex, or what we call the hyperreflection or the hyperreflection. Of course, if a CNS is present, we can safely assume that it's going to be hyperreflection. Good. Second would be lethargy or agitation. So you know what is agitation means, right? So technically you will pick up the lethargy. So yeah, that's going to be the correct answer. Right? Restlessness versus obtunded. So you know what is restlessness, so definitely it's going to be obtunded. Okay, the main reason why they're not testing you with those lists that has been provided, because in every area or in every state, in every practices, countries where the book were being produced, they have different sorts of lists of possible signs and symptoms of these imbalances, but rather we will be doing it like in the principle of how it should be. Okay, so the principle of knowing these things will help you determine what will be the possible signs and symptoms of the patient is having if they have this kind of imbalances. Okay, so the rules would be, our second rule would be, as the pH goes, so goes my patient, except for potassium. Okay, so meaning to say, if the pH goes up, the patient goes up. The symptoms and everything follows, so it goes up. If the pH goes down, the patient goes down, become relaxed, become stagnant, become not stable, but rather become much more lucid on the way. So on the first principle, we are more particular with the bicarbs, but here in the second principle, or the second key that we're looking into, mainly lies from the pH. Okay, so the first one, we are trying to determine whether it's respiratory alkalosis or respiratory acidosis based on the values been given. But in the second one, the second principle, will be checking on the signs and symptoms which possibly occur when this kind of imbalances has been given to you in the boards. So if we say as a principle that if the pH goes, so goes my patient, except for potassium. So it's going to be kind of opposite. All right, it's always going to be opposite. Okay, so let's an example with this one. With this pH value, it's more than 7.45. So we can assume that the system is more irritable or in a hyperactive stage. So we can safely assume, we can safely say that the possible symptoms that we can encounter in this kind of scenario will always go up, 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 up. Now, in the second example, as you can see, it's pH going down. So, basing on the principle, so if the pH goes down, we can safely assume that the system of the patient is shutting down as well. Okay, so what we says that if the pH goes up, so goes my patient, irritable, so meaning pH goes up, so meaning it is alkalotic in nature. So what are the things that you might see? Of course, one would be hyperreflection. That's the simplest one, versus the hyperreflection. Of course, the patient will get a little bit irritable, then being calm, then being relaxed, and then reflex of 3 to 4 versus 2 or versus 0 to 1, because 3 to 4 is considered high and 2 is normal and 0 to 1 is considered low. So what else we can see in this scenario? So we can consider also tachypnea, tachycardia, alright, increased bowel sounds, which what we call borborygmi, or the increased bowel sounds. So this is the time when you examine the bowel, you will hear a lot of growling sounds on that area. So it's just like full of air, like something like that. Okay. So what is the other way around? So if the pH goes down, so goes my patient. So meaning to say the pH goes down, so meaning the nature is acidosis. So what would we be expecting to the patient? Of course, not gonna be irritable, but rather they will be more obtunded or more relaxed and calm. Hyperreflexia or reflexia of 0 to 1. Of course, bradypnea, bradycardia, And the counterpart of borborygmi, which is the increased bowel sound, is paralytic ileus. So meaning to say, it doesn't move at all. Very, very minimal movement or bowel sound that you can hear during your assessment. How about seizure or coma versus coma? Okay, so it's gonna be coma. Because coma, yeah, it goes down. So technically, once we say respiratory arrest, coma, we are saying that this having a respiratory acidosis. So technically, from this instance, you will identify whether the patient needs an ambibud. So like for example, which metabolic acidosis needs an ambibud? So definitely you will check possibly coma or cardiac problem. So with that one, the patient goes down. So we can safely say that this is respiratory acidosis in nature. Why respiratory? Because majority of that one is airway problem in coma. Another thing is that when a patient is seizing, so patient goes up, so it's alkalotic. So might be that is the problem with this patient. So he's having like an alkalotic imbalances in the body, which actually needs a suction machine bedside. So this is the difference. If the patient is having acidotic, we need an ambibud. Alkalotic, we need a suction machine because it might seize and be aspirated. Okay, so before we proceed on, I'll be sharing this specific signs or symptoms as we speak, that it, when you see the signs and symptoms, it always pertains to one specific acid-base imbalance. So when you see KUSSMAULS, KUSSMAULS is a compensatory respiratory pattern which usually found in diabetic person. And when you see this one in the statement, like for example, it says that what is the acid-base imbalance, that the patient was having a KUSSMAULS, was breathing like KUSSMAULS, is undergoing to. So I mean, the only imbalance that you need to answer for this one is going to be metabolic acidosis. So if we coin this, it's make more simpler, like we can call it like MAC KUSSMAULS. So MAC is going to be metabolic acidosis, and KUSSMAULS for the compensatory respiratory pattern. Because usually this kind of questions usually fall into SATA questions. Like for example, if you have a patient who's having respiratory acidosis, what are the possible signs and symptoms you can see from them? Okay, so it's gonna be either positive reflexes or positive 4. So you will pick +1 reflexes. Hyperreflexia or hyperreflexia. That's gonna be hyporeflexia. Constipation versus diarrhea. Not diarrhea because diarrhea is going up. It's losing a lot of fluid. So it's gonna be constipation. All right. Urinary retention or urinary incontinence. Retention, so meaning to say urine is not getting out, so it's down, so you go to retention. Paroxysmal atrial tachycardia or atrial fibrillation versus second-degree Mobitz type 2 heart block or first degree. So from the word itself, it's block. So definitely that one would be the acidotic because it's going down. How about hyperkalemia versus hypokalemia? Well, if you answer hypokalemia, that is wrong. Because if you're going to apply the rule that as the patient goes, so goes my patient except potassium. So potassium and pH doesn't go well in this principle, so it goes in a different direction. So if the pH goes down, so the the potassium goes up. So it's the other way around. So for respiratory acidosis, which pH going down, so we will pick hyperkalemia or high K. Okay, because the thing is, the reason is boards doesn't want you to remember or to yeah, remember or to give more emphasis on the list, because the thing is different different areas, different resources has different kind of lists. But knowing just the principle, how it goes from acidotic to alkalotic environment will give you the general idea of what possible symptoms that you may encounter the patient who's having this kind of problem. And then another thing in SATA questions, so what I saw and what actually been researched, that a lot of students was getting wrong in this question, set of questions, is because they always ask it could be or it might be. Okay, so so having this always thought, it's a big no during the SATA question. So if you don't know the answer, then do not answer. If you do not know if it's true, then don't pick it, don't answer it. Because it's in SATA, it is never only one or never all of them. So never answer just one in SATA and don't answer all of them. Now, another scenario. In this scenario, they always ask the causes of acid-base imbalances. From the other one, they asking the signs and symptoms. But this one, they will ask you what is the cause of acid-base imbalances. Like for example, they say that what is happening in your patient. So what acid-base disorder will result from this. So they're trying to flip it around. So this is like signs and symptoms versus causation problem. Like for example, diarrhea will cause a metabolic acidosis. But once you get acidotic, it shuts your bowel and you're having a paralytic ileus. So this is how they messes up the causation and the signs and symptoms. Alright, so with this one, the way we will answer this is basically whenever you get this kind of scenario, the first questions that you need to ask yourself is the question is pertaining to lungs. Alright, so if it's a lung scenario, your second question would be, is the patient hyperventilating or hypoventilating? So this is very crucial for respiratory, because if we say hyperventilating, we have the idea that it goes up. So this is alkalotic in nature. So since this is alkalotic in nature, at the same time, it is a lung question. So we can say and safely say that this is a case of respiratory alkalosis. Now, if it's hypoventilating, so it's going down, we can safely say that it's respiratory acidosis. Now, like for example, they will try to mix things up, and then in the statement you will find that the word overventilating. So instead of hyperventilating, we will check the overventilating. So when we say over, meaning to say it's alkalosis, that's the closest connection. Than usual, the normal, the way it is. Underventilating, that's gonna be acidosis. Right, so meaning to say you're just translating it. So over is going up, so alkalotic. Under going down, which is acidotic. So you're just trying to translate things. Now, in cases of drowning, should we consider this lung scenario? Yes, of course, it's a lung scenario because the patient who is drowning cannot breathe properly. So technically, the patient is underventilating or hypoventilating. So the possible disorder of that the patient is having is respiratory acidosis. How about having the case of emphysema or air trapping? the same thing. So it's underventilating. Respiratory rate is different from ventilation, huh? Because the thing is, respiratory rate explains how the patient is determines the respiration, number of counts of respiration. But when we are saying ventilation, we are checking the SpO2 of the patient. So if it goes down, it goes down. It goes up, it goes up. How about emphysema or air trapping? So meaning say the lungs, the air is not properly circulating, it's being trapped, it's not getting out. So meaning to say there is underventilation, so respiratory acidosis will be the answer. Okay, second question is, what if the question is not about lungs? Alright, if it's not about lungs, then it is metabolic. Now, in metabolic, there is always good rules in order to determine. If the question says it is prolonged gastric, vomiting, or suctioning, again, if it stays prolonged gastric, vomiting, or suctioning, it is metabolic alkalosis. Why? Because when you are vomiting and you are doing suctioning, you're taking out the acid. So it's losing acid. So once you lose acid, you're becoming more base or alkalotic. Otherwise, if it doesn't says anything like that, and it's not long, then you pick metabolic acidosis. Okay? Then you just pick metabolic acidosis. Example, a patient who's undergone a surgery, post-op surgery, who has nasogastric tube in low intermittent fasting, low intermittent suctioning for 4 days timing. So what's going to be your answer? So it's not long, so we go to metabolic. And it says during the rules that if it's prolonged gastric or vomiting or suctioning, we choose metabolic alkalosis. Okay? Now, hyperemesis gravidarum, or those pregnant women. Okay, so it's not long, but the patient is vomiting continuously, prolonged vomiting continuously. So it's going to be metabolic alkalosis, the same. How about hyperemesis gravidarum, which is now dehydrated? No more prolonged vomiting. She's no longer vomiting, and she's now dehydrated. So we'll be picking metabolic acidosis. Acute renal failure. It's not long, right? It's not even prolonged suctioning or vomiting. So just pick metabolic acidosis. Which means everything else that's not pertain to lung and not prolonged vomiting and suctioning, you pick metabolic acidosis. Alright? Everything else. And also, if you don't know what it is, pick metabolic acidosis. It's always 100% sure that it's gonna be metabolic acidosis. Well, as per my experience as well, because I had this examination which I'm not really sure what's gonna be it, so I just picked metabolic acidosis, and it shifted me to a much more difficult question, because that's how it works in the boards. They'll be throwing you an easier one, and then if you get the answer to that question, then you'll be given their next question, which is more difficult. It's either gonna be SATA, or a difficult one sentence questions, or can be prioritization or delegation. Could be. And what happened to that experience of mine, I was given a much more difficult question, which is SATA. Okay, then so what are the things that we need to know for acid-base imbalances? So if the pH and bicarb are in the same directions, we can say it's metabolic. So it's the rule of B's. Bicarbs, both bolic. Second principle, as the pH goes, so goes my patient except for potassium. The pH goes up, the patient goes up except for potassium, so it goes down. If the pH goes down, so does my patient, so the patient goes down, so everything is down, shut down, the symptoms is going down, so except for potassium, which is hyperkalemia. And then remember, the KUSSMAULS. So KUSSMAULS is only the compensatory respiratory pattern that we can only see in metabolic acidosis. And then overventilating or hyperventilating or underventilating or hypoventilating, just translate it. So over is high, so that's going to be alkalotic, and then under is low or down, which is going to be acidotic. So pick the right term. And this is long, so a long scenario, so technically choose respiratory. Now if it's prolonged suction and vomiting, pick metabolic alkalosis because acidosis are getting out from the system. So what's happening is it become more base. All right, and then for everything else, which is not lungs and not prolonged suctioning or vomiting, pick metabolic acidosis. And also, if you don't know what to pick, just pick metabolic acidosis, because it usually happens that almost always is always like that. Okay, I hope you understand some things for my acid-base imbalance, and now we will proceed to ventilation. Okay, first two things that you need to know in ventilation is basically the alarms only. All right, so what does it do and what does it cause? Okay, for the first alarm, either be high pressure alarm or low pressure alarm. When we say high pressure alarm, meaning to say there are increased resistance to the airflow. So basically it's like from machine going to the patient scenario. Machine going to the patient scenario. So the machine is having a hard time pushing the air to go to the lungs. So what would be the cause? It might be obstruction. So what are the usual obstruction that we can see in this kind of scenario? So either can be SATA questions or click and drag or drag and drop. So which order that you need to do first? So the first obstruction that we can say would be kinking. So there are kinks in the tubing, or tubing are kink. So what are the things that we can do for that? Of course, it's unkink. Straighten it up and try to lose it. And then the second one would be condensed water in the tubes. So there are dependent loops in the ventilation process or tubings that condenses can be there. So technically water builds up and it limits to push the air. So it blocks the airs for some reasons that you need to empty it. And of course, mucus secretions in the airway itself. So we can find a lot of mucus secretions, but it doesn't always be like your main priority would be suctioning. For what reason? Why? Because you're not going to, aside from putting on hyperventilating the patient before suctioning, it's not a usual thing that we need to do first, because the more you try to suction the patient, of course you're trying to limit the oxygen, even you pre-oxygenate. At the same time, it causes more secretion to go back. Okay, so the first one that we need to do is try to turn the patient as much as possible. Try to turn it, make him cough, and do some deep breathing. Okay, cough and deep breathing. So there are questions, or there are sets of questions in the board that they will ask you in which order does it go first. So for this one, we should pick number one should be unkink or kink from the kink itself. Then remove the water. Then turn. Then cough and deep breathe. And then the last would be suctioning. If you did all of this and still the same, you go for suction. Okay, the second alarm would be the low pressure alarm. So what does it indicate? If the high pressure alarm indicates increased resistance, this one is decreased resistance, or the machine is not having a very hard time pushing the air to the patient. For what reason? It might be disconnected. So with this scenario, it's going to be patient to machine problem. So check the main tubing. If it's disconnected, so what you can do is reconnect it. Another thing is that the oxygen sensory tubing has been disconnected, so technically reconnect it again. Okay, so in general, we are having a high pressure alarm if we have an obstruction, and low pressure alarm if we're having a disconnection. Okay, that's how it works for the ventilators. All right, so yes, well, thank you so much for hearing me out and staying tuned in this lecture of mine. I hope you enjoy it and I hope you learned something from it. And I'll be posting a lot more about Nclex tips and tricks as much as I can. And I'm hoping that you'll be subscribing if you haven't subscribed in my channel. And well, see you passing the Nclex examination. And yes, congrats in advance and thank you so much. Keeping it tuned. All right, thank you guys.